Welcome back to another episode on the Healing Wellness Show. I'm your host, Dr. Karim, and today we're going to be diving into a powerhouse of a topic. It's your thyroid. We'll talk symptoms, labs, misdiagnosis, treatments, and lifestyle because this small gland plays a huge role in your health. Joining me today is Amanda, our fantastic nurse practitioner at Iowa Wellness Center with years of experience in helping people reclaim their vitality through proper thyroid care. Amanda, welcome back to the show. Why don't you introduce yourself for those listeners that haven't seen you before?
So I'm happy to be here. Like he said, I'm Amanda. I'm the nurse practitioner here. And like he said, I have a lot of experience in managing thyroid. And I'm really excited to talk about it today as I'm very passionate about it. I've helped a lot of people with their thyroid. And so I'm happy to be here.
All right, Amanda. So what exactly is the thyroid and why is it important to your overall health?
Yeah. So like you said, it's a small gland, but it's mighty. It's powerful. A lot of people know of it as the master gland, in fact. So will you keep the question up so I can just read it while there we go. Okay.
So start again.
So, like you said, the thyroid, it is a small gland, but it's mighty. It's sometimes known as the master gland, in fact. It's important to everything. I mean, you literally have thyroid receptors head to toe. So, yes, it's a small gland. It sits in the neck, but I don't really know anything it doesn't do. So, we'll dive a little bit deeper into that more specifically. But yeah, thyroid controls everything. So that's something that I'm going to check first since they're coming to me with symptomatology. The thyroid is very important.
So when you talk about control everything, what kind of things does it control?
Yeah. So biggest thing is it's going to help with organ function. It helps with from the cellular level. It helps with inflammation. It helps with hair, skin, nails. It helps with cognitive impairment, fertility, really, energy, mood, gut health, constipation, really anything and everything you can think of. There is a thyroid component to it.
Wow. So what's the difference then between you hear hyperthyroidism and hypothyroidism?
So most of the time, unfortunately, I'm dealing with hypothyroidism or kind of a slow functioning thyroid versus hyperthyroid primarily as a over functioning thyroid that you can see sometimes in like Graves' disease, which is an autoimmune condition. But most of the time I'm dealing with hypothyroidism. So everything's just kind of slowed. So think about how you feel when everything's slowed down. You have constipation, you have cold intolerance, you're fatigued, you have weight gain. So think of it like that. And then hyperthyroidism, on the other hand, is going to be everything's kind of sped up. So palpitations, maybe some anxiety. But again, that's more rare. Unfortunately, I see more of the hypothyroidism.
So what are some of the common signs and symptoms that people might experience when the thyroid isn't functioning as well?
Yeah, so a lot of times it can go hand in hand with other things like we'll talk about in a little bit, but most of the time they're coming in because they're fatigued, they're not sleeping well, they're gaining this weight that they don't know why, despite them following a healthy diet or exercising, they're still gaining weight. Maybe they're cold intolerance, maybe their hair's falling out, their nails are brittle, their skin is dry. So those are most of the things that I see that go hand in hand with thyroid.
So why do so many thyroid issues go undiagnosed or misdiagnosed?
Yeah. So the problem is it's important that we check all aspects of the thyroid. Unfortunately, most providers are just going to check what you'll probably hear of as a TSH, and that's really not a diagnostic tool to use for addressing thyroid function. So, if their TSH comes back, say, within a normal range, the patient is told, everything's normal, you're fine, we'll see you in 6 months. So, and then the patient leaves, they're upset, their symptoms are still there, they're placed on maybe like a levothyroxine or a synthroid to help support the thyroid in theory, but they never get better. And so it can be very frustrating because we're not looking at all of the components of the thyroid. And so that goes into what are we checking for? So yes, you're looking at the TSH, but what's more important is checking that free T3, which is the active form of the thyroid, checking a free T4, checking a reverse T3, and more importantly, checking for antibodies. The number one cause of hypothyroidism in America is Hashimoto's, which is an autoimmune condition. And I catch this all the time. It's very, very prevalent. Most patients don't even know they have it. Most providers don't even check for it. Like I said, they just treat based off of a a TSH. So it's really important that we're addressing all components.
So we talked another episode about labs and checking labs. And so you're talking about, the TSH and the T3 and the T4. Can you just explain it to the listeners? What are those tests, and what is it that you're looking for in these tests, and what's normal, what's not?
So your thyroid excretes 5 things: T2, T3, T4, and calcitonin. We're just going to focus on the T3, T4 for now. But the free T3 is, like I said, it's metabolically active. So it's working like a lock and key on those receptors. And the TSH essentially is just a signal. So the TSH is not a thyroid hormone. It's a thyroid stimulating hormone. So it's actually a hormone in the brain. So the brain signals to the thyroid, hey, we need more of this. Okay. So the T3, T4 is coming from the thyroid. If we're not checking for those, though, we have really no idea, are they optimized? A TSH, can be a great test, but at the same time, it's not, because it can change, do you have a diabetes? Do you have obesity? Do you have dysbiosis? Do you have, stress in your life, which we all do? Are you of a certain age? Are you of a certain ethnicity? So all of these things are going to change this TSH, and we're using this to dictate how we treat the thyroids. As you can see, there's just a lot of problems with that. So, a free T3, an optimal free T3 is what I'm, going for, and that's where we achieve symptom relief. Usually when you're looking at a TSH to free T3, they have an inverse relationship. So as that TSH or that signal comes down, that free T3 is going to come up. I like the free T3 to be between 4 and 4.5, or at least the upper quartile of that reference range. So I don't usually use the word normal. Just because you're in a normal range does not mean that you're optimal, does not mean you're achieving the symptom relief. So really focusing in on getting that free T optimized, making sure the free T4 is good as well. But again, T4 is inactive, so I'm more concerned about the free T3. A lot of times with your levothyroxine, Thyroid, those are all synthetic medications that actually do more harm than good. A lot of my patients have been on this medication for years and years and years, and they have no idea why. Their symptoms are still present. They're just told, take this medication. So we're really not honing in on the free T. The levothyroxine Synthroid is just T4. So it's the storage hormone. They take this medication, the T4, your body still has to convert that T4 to T3 in order for you to get the benefits from it. And a lot of times patients don't convert to T3, whether that's due to age, like I said, due to obesity, due to a body that's full of inflammation, poor diet, the list goes on and on. But we need to, in that case, we need to make sure we're giving them that free T3, or doing things to increase it. And then the reverse T3 is basically just free T3 that's inactive. So that's going to elevate with stress, a lot of times stress and inflammation. So, and then, like I said, the antibodies, we got to look at those because, we got to treat them. The quicker, the better that we can get patients on treatment plans to help decrease those antibodies as well.
So you kind of talked just a little bit here about normal is not normal. What does that mean?
Yeah. So just because you're in a certain range does not mean that you're, normal. So the biggest thing is listen to your patients. If they're still having symptoms, then we're not optimized. We haven't done our job. So I don't like to use the word normal. I like to get patients to where they feel good, and do what works. Get their receptors cleaned up, get their adrenals functioning better, get the inflammation down, those kind of things.
And that's typically when someone says, hey, my doc said that I'm normal. Is that more about like...
They're just looking at the number. They're not treating the patient.
Okay.
Yeah.
Okay. Thanks for clarifying that. Can you walk us through approach to treating thyroid disorders?
Yeah. So biggest thing is just like you do with everything, getting a good history and physical, talking with your patient, figuring out what symptoms they're experiencing, and then starting, with that lab draw. If I'm concerned about adrenal insufficiency, do we need to check a 4-point cortisol saliva test? Do we need to add in some adaptogens? Do we need to add in nutraceuticals? Do we need to switch them from levothyroxine to something better? Whether that's initiating some T3 and with the T4, switching them to something more pure like a tyrosine, or in a lot of cases, I prefer to use desiccated thyroid. It's a porcine extract that actually has T3 in it, which is like like I just mentioned, is the key component to that. So it's really talking with them and letting them know that they have options because again, they're just told your thyroid's under functioning. Here's some levothyroxine. And they've been on this medication, like I said, for 20, 30 years and they, for nothing.
Is there a situation where you would recommend one of, the meds that you just recommended compared to the other one?
Yeah. So the biggest thing is if they've been on the levothyroxine and they're still sitting in front of me with all of these symptoms, I'm going to tell them we need to change this. So whether that's they want to go to their doctor and have this conversation with their doctor who's prescribing that medication, or I manage it and I wean them off of the levothyroxine or Synthroid and move them to more of a desiccated thyroid or add Cytomel. And then I'm managing their thyroid and, it works really well, and I do it all the time.
So going back to managing the patient, have you worked with patients where you manage them and someone else is managing their hormones as well? Or do you typically say, hey, let's just have one of us manage it?
Yep. So I'm very clear with my patients. If I'm changing their medications, I manage their thyroid. Their regular doctor might still check levels, but they're not checking the levels that I'm checking and they're not treating to what I'm treating to. So I manage the thyroid. And so what that looks like is just staying on top of labs, adjusting medications, symptoms. But yeah, I prefer to take over if I'm managing.
And why is it important to have just one provider manage hormones compared to multiple?
Yeah, I think just, in any case where you're managing, a patient on a medication, you should never just start something and then never follow up or see it through. I think my patients just need to know that, I'm educating them on this subject. They know what's right. They agree that, hey, we need to do something because what you're doing now is not working. So they trust me. We build that rapport. They're educated. They know that they want to make that transition. And so they know then at that time, I will be the one that's going to address, from here on out. So, and usually it's a very, no questions asked, the patient's confident. They want to, there's no problems.
So how do you monitor and adjust medications over time with, say, a patient that starts with you?
Yeah. So typically if I'm starting them or changing their medication, I'm going to give it about 8 to 12 weeks before I recheck. And then anytime I'm adjusting the dose or, changing anything, I'm going to, again, recheck in about 8 to 12 weeks. So if things are going good, we haven't changed dosing in some time, maybe we can go to every 6 months. But I would say that's the very, minimum.
Does diet, supplements, or detox protocols play like a role in the thyroid recovery?
Absolutely. So they all play off of each other. So looking at, like I said, cortisol, if I think, stress is a component, which in most cases it is, ensuring that their adrenals are functioning properly. Are there any vitamin deficiencies that we need to address? What's their gut look like? Is their diet poor? Are they full of inflammation? We need to get these receptors cleaned up so that their body can accept what I'm giving it. So yes, it plays a major role in thyroid optimization.
So how do, you keep talking about stress and adrenal fatigue. How does that influence the thyroid?
Yeah. So I think, they work hand in hand. But I think the biggest part is really honing in on the thyroid, getting the thyroid optimized, making sure their ferritin level is good, addressing the, getting to the core, the root cause of the adrenal fatigue. Why are they stressed? Are they changing jobs? Are they, is their marriage bad? Are they, what is going on in their life that's causing the stress to begin with? So getting to the root cause and then, like I said, providing them with adaptogens to help with those cortisol levels, whether they're too high or too low. And then talking about hormones, testosterone, estrogen, those are going to be a big part of the picture too. But it's a whole picture. You have to treat the whole patient. You can't just focus on one thing or the other because they're all bouncing off of each other.
So how do you help a patient who feels like their symptom is ignored or dismissed?
Yeah, so I think it's just, again, plotting that timeline, figuring out where to start, what's the root cause, what are the issues, doing labs, figuring out where the deficiencies are, supporting them in all aspects, and just knowing that, like I said, building that trust with them. They know that I'm going to help them. We're going to get to the root cause. We're going to figure out what it is. And, maybe we need to adjust a couple things, but yeah, just listening.
Well, let's switch over to how does thyroid help with fertility, pregnancy, postpartum?
Yeah, so you'll find a lot of times females who are struggling to get pregnant or having miscarriages. A lot of time, their thyroid's under functioning, or they have Hashimoto's. Their antibodies are through the roof. Their free T3 is, very, very low. If you just reverse that, I mean, if you just get their free T3 up and get their antibodies down, it makes a world of difference. I mean, it truly is a cause of a lot of fertility issues, and we see that just by optimizing those things, patients are able to get pregnant a lot easier.
Would you say thyroid problems are more female related, or can men also get it? And if men can get it, what are some of the symptoms that they can watch out for?
Yeah, in Hashimoto specifically, it's about 8-to-1 female to males who are getting Hashimoto's. Usually it's between the age of about 30 and 50. But yeah, men can have the same type of symptoms. The other thing to think about is usually if they have one autoimmune condition, they have multiple. So whether that's RA, multiple sclerosis, lupus, colitis, the list goes on and on. But the biggest thing is we need to interact. We need to get those antibodies down. The other thing is, only about 20% of people are symptomatic, which means, they might not have any symptoms until, their antibodies are through the roof. So it's one of those things that everyone that I see is going to have a full thyroid panel drawn. But yeah, men and women, they present with the same symptoms.
So is this something that could be seen in children? And if so, what should parents look for, like red flags or anything like that?
Yeah, I think just energy, mood, anxiety, depression, weight gain, any of those changes that are noticed. I think it's always valid to think thyroid and talk to someone that you trust, someone that you know is going to do a thorough thyroid panel, check for ferritin levels. Again, teens are.
Can you talk? I mean, you've been talking a lot about emotional and mental health, so what's the side of the thyroid dysfunction from mental health, emotional?
Yeah, so I mean, depression, anxiety, those can all stem from thyroid dysfunction. So something as simple as, like I said, optimizing these levels, checking for antibodies, getting things.
What's your view on preventing screening for thyroid issues?
So yeah, I think everyone should have their thyroid screened. I think
What age would you say?
I mean, I just had a 15-year-old in my office that I checked because she was having cramps in her legs, and her therapist said, maybe it's her thyroid. So really there's really no age limit. Most of the patients I treat are older. I'd say anywhere between, starting from age 25 and up. But there's really no age limit. I think it's important to address thyroid should any symptoms start to arise.
And what's your message to someone who's struggling or feeling unheard?
I think the biggest thing is just be an advocate for yourself, ask questions, ask for a free T3 to be drawn. Obviously, you can always come here and see me, but, be an advocate, ask why you're on this medication, ask about optimizing or, initiating T3, educate yourself, and just know that there are other options out there. And like I said, I think, asking to have more than just a TSH drawn, and really getting to the bottom of the issue is important.
And if someone wants to come and see you, what are the steps, or what do they need to do, or what does the visit look like?
Just give us a call. You'll have a consult with me, and we'll kind of dig down deep and find out what the next steps we need to take. Usually I start with, like I said, a history and physical, get some information, do labs, and then from there we can figure out next steps.
Any success stories that you could share with us about thyroid? And
yeah, I mean, in general, most of the patients that I'm able to transition to NP thyroid, they just feel a lot better. They have more energy. They're able to lose weight. They don't have the cold intolerances, more alertness, focus, less fatigue. They're sleeping well. Their depression's better. Their gut health's better. I mean, the list goes on and on. It's awesome.
Any last words that you want to share with our viewers?
Yeah, I think really just honing in on, I know I talked a lot about the levothyroxine being the end all be all. I think they're just handing it out like candy nowadays. And I think we need to ask more questions. And I think it's important to see a provider who understands thyroid. The other piece I wanted to mention is I think there's some myths in suppressing TSH, excuse me, and that causing bone loss, the studies show that unless the body is endogenously making that T3, which means the body's making it themselves, that's a problem versus exogenously giving that, which would be me actually giving a patient a pill that has T3 in it and suppressing the TSH. There is no literature to show that to be a case of, causing bone loss. That would be more so in a case of a patient developing like Graves' disease or something like that. So that's one of the big myths that I do hear about. The whole idea is endocrine mimicry, right? So we want to give the body what it naturally is used to doing. And the biggest thing is, if we can get patients off of the medication, that's even better. It's not made to stay on. That's another thing, is patients think that if I'm taking this thyroid medication, I have to stay on it forever. And that's simply not true. I mean, I've been able to wean patients down and off of their NP thyroid as we clean up their body, so whether that's getting on gut health, fixing vitamin deficiencies, fixing their adrenal insufficiencies, ideally we want to get them off of it. It's more of just, kind of a, to get them through this while we're cleaning things up. But yeah, it's definitely not something that we have to stay on, and our goal is to get you off. So I'd be happy to. I am very passionate, like I said, about thyroid health, and come see us.
Well, thanks, Amanda. Thank you for joining us today and sharing your wisdom and wealth again. And we're definitely going to have you on more shows talking about different topics. So, yeah, viewers, if you have any other topics that you want Amanda to talk about, please put them out there and we'll bring her back, talk about different things. So if you're listening and wondering if your thyroid might be behind your symptoms, don't wait. Get evaluated, get educated, and get empowered. So go ahead and subscribe to the Healing Wellness Show on Spotify, Apple Podcasts, and follow us on social media for more insights every week. If you want to book an appointment with Amanda, the number on the screen will get you connected with her. And thank you again, Amanda.